Hi everyone, welcome back to my YouTube channel. Today we are going to talk about frontal bone, and here as you can see the diagrammatic representation of skull showing the bone highlighted area, that is the frontal bone for the reference. So let's start the topic with introduction. Frontal bone is a large singular bone at the front of skull. As you can see here in the diagram, it forms the forehead, part of cranial roof and superior walls of orbit. It also participates in formation of anterior cranial fossa housing the frontal lobes of brain. Now let's talk about anatomical regions of frontal bone. It has squamous part, that is vertical portion, and orbital part, that is horizontal portion, and nasal part. So let's talk about these anatomical regions one by one. First, we have a squamous part or vertical portion of frontal bone. It forms the forehead. It is marked by two smooth elevations that are called as frontal eminence that are more prominent in children. It includes the glabella, that is a smooth, slightly depressed area between the eyebrows. It contains the supraorbital margin with the supraorbital foramen or notch, through which nerves and vessels pass to the forehead. Next anatomical region we have is orbital part or horizontal portion that forms the roof of orbit. It is divided into two orbital pairs separated by a gap that is called an ethmoidal notch. The notch accommodates the ethmoid bone and contains small pits for ethmoidal air cells. The next anatomical region of frontal bone is nasal part that project downward between the eyebrow. It articulates with the nasal bone, maxilla and nasal cartilage. It contains the nasal spine which contribute to the nasal septum. Now let's talk about frontal sinuses that are located just behind the superciliary arches. They are air-filled cavities lined with mucosa. They are present by age 6 and grow through adolescence. Function: they lighten the skull, humidify air, and enhance voice resonance. They open into the midline meatus of the nasal cavity through frontonasal duct. Now let's talk about articulations of frontal bone. Frontal bone articulates with 12 bones. These include cranial bones and facial bone. In cranial bone we have is two parietal bone, one sphenoid bone and one ethmoid bone that articulate with the frontal bone. In facial bone we have is two nasal, two maxillary bone, two lacrimal bone and two zygomatic bone that articulate with the frontal bone. The coronal suture marks the articulation with the parietal bone. Now let's talk about surface landmarks and attachments of frontal bone. First is superciliary arches, that is prominent ridges above the orbits. Second is temporal line, that is arch ridge that mark the attachment of temporalis muscle. Next is frontal crest, that is the midline ridge on the internal surface for the attachment of pallex cerebri, that is the dural fold. Now let's talk about development and ossification of frontal bone. Frontal bone develops from two ossification centers in the embryo. Initially, they are separated by a mitopic suture which usually fuse by age 8. In some adults, the mitopic suture preserves partially or fully, and that is known as mitopism. Now let's talk about clinical significance of frontal bone. First is frontal sinusitis, that is inflammation of frontal sinuses that can cause headache and facial pain. Next is fracture, that is a trauma to the frontal bone and it may lead to the orbital roof fracture or damage to the frontal lobe. Next significance is surgical access, as neurosurgeons sometimes access the brain through the frontal bone through for the procedures like craniotomy. Now let's talk about conclusion of this lecture video. From shaping the human face to housing the frontal lobe and sinuses, the frontal bone is as functionally vital as it is structurally prominent. Understanding its anatomy is key to medicine, dentistry, neurology, and forensic sciences. And this was all about the frontal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.